want to speak today is about how do we think differently about the convergence and the future of health and medicine through the lens of technology. And as I mentioned earlier, I've been lucky to be to Chile several times, an amazing country, amazing energy. And many of the technologies that we see in Chile and around the world are accelerating and give us a real opportunity to think differently about the future of health and medicine. Just like we've disrupted how we do our banking and our movies and our entertainment, we've seen change come. And disruption has certainly come to all of us through the coronavirus. And if there's a bit of a silver lining to COVID, it's that we're starting to learn things more quickly and to accelerate how we practice and accelerate health and medicine around the planet. In fact, I like this slide, who led the transformation of your company, the CEO, the CTO, or COVID-19? And COVID-19 has been a catalyst. Just like Sputnik set off the space age, COVID is sparking a bit of a health age and giving us the lens to use science in new ways to bring us vaccines very quickly, from sequencing the virus in January of last year to having clinical trials start a year later, now to having multiple trials in the arms of patients around the world. So we really have the opportunity to learn from COVID and to think differently as we move forward, particularly through the lens of exponential technologies. I chair a program called Exponential Medicine. I'm also chairing the XPRIZE Pandemic Alliance Task Force, and our goal is to bring people from all around the world to think about the possibilities to address challenges for the pandemic, for prevention, for managing diabetes, obesity, cancer, and beyond, and to really reimagine health and medicine around the planet. Now, part of that reimagination means we need to appreciate how quickly technology is accelerating. Many technologies are moving exponentially, doubling in their speed and performance every year or 2 years. We know Moore's Law, which is why our magical smartphones, our supercomputers, even my antique iPhone 2 is incredible technology that is moving very, very quickly to the point where our mobile phones are really becoming medical devices. You can do a diagnostics in your child's ear. The microphones, the cameras embedded with AI and machine learning are really making these sort of telemedicine platforms to the point where we'll soon see, our iPhone 12s dissolve into Apple augmented reality glasses. So we need to pay attention to the pace of change because, the computer that fit on your desktop now fits on your Apple Watch or your medical, and these medical devices on our watches are becoming interconnected, and consumer devices are blending with medical. And it's not just, of course, about wearables, but this convergence of sensors and AI and big data and 3D printing and nanotechnology, all converging, super converging, that gives all of us the opportunity to think differently about the future of health and medicine, and all to play a role at this convergence of technology and healthcare, creating entire new fields, from artificial intelligence meets radiology to precision robotic surgery. All these things are here today. The challenge is to really bring them into the world and in ways that brings it across the world in equal ways. But even though we're in 2021, that used to feel like the future, sometimes healthcare feels a little bit stuck in the past. I'm sure many of you are still experiencing using fax machines and paper forms and waiting rooms. We need to get out of our mindset of moving data around on CD-ROMs and waiting in waiting rooms sometimes for hours. We're still using the same public health prevention modalities from over 100 years ago. So I challenge all of us to think outside of our old silos, outside of the waiting room, to think about how do we break open our minds to move forward. Not just thinking about technology, but thinking also about our social determinants, because often where we live and our access to clean water and good food and vaccines is much more important than the pure technology piece. But let's look through a bit of the lens of technology and how it can shift us from what we really practice today, not healthcare, we practice sick care. And how do we move from sick care to healthcare? First of all, sick care is sort of our normal practice, where we get very intermittent amounts of data, usually in the small amount of time that you visit your doctor or in the hospital or emergency room. That very intermittent and episodic data leads to our reactive sick care model, where we wait for the patient to show up with a heart attack or a stroke, or in my world of oncology, cancer, often presenting with late-stage disease, or we wait for the pandemic to arrive on our shores. And the potential of a lot of these new technologies that are here today is to not have intermittent data, but continuous data that's much more personalized to you, enables us to be more proactive, more preventative, and starts to bring care anytime, anywhere, at low cost with better outcomes. And part of that technology, of course, is our sort of magical Internet of medical things. We're now riding 5G in many parts of the world, and that means we can collect data from all sorts of new sources. And that gives us a new opportunity to have mobile health, connected health, or sometimes it's called digital health. In a sense, we can now connect these new data sources to the individual and use them in powerful new ways. And it's often shifting how and where we do care, from the hospital to the home, virtualized care, or hospital to hospital. That certainly has been accelerated in the coronavirus era. And there's a lot of innovation around digital health in Chile, some amazing companies, startups, all coming together, often catalyzed by your leadership and your governments and partners. And it often takes that leadership and private-public partnership to create the interconnections between the data and to create the apps and platforms that can really accelerate public health and everything from managing obesity to cancer care. Now, part of the challenge with our Internet of Medical Things and big data is we're creating lots and lots of new big data from our wearables and our genetics and telemedicine. The challenge is data alone is not the solution. We need to take that data, turn it into actionable information, and bring that information to you as an individual and to your doctor and your healthcare system, and just speed up and narrow that gap, which often takes years. And that's starting to happen in our era today, and bringing a new lens to both prevention, diagnostics, therapy, and even global health. So let's quickly go through each of these and help think differently about what you can do today and what's coming next. First of all, we want to think about health and prevention. We just heard about obesity. We don't want to wait for obesity to happen to us or our patients. We need to understand, even though there's a genetic basis, a lot of things come from our behaviors: too much smoking, stress, bad food, not enough sleep. Now we're in a time where we can start to measure our behaviors. Many of you are wearing wearables. I have 4 different devices on me right now. In fact, I was in the Atacama Desert in 2003 developing one of the first wearables for NASA. And now these are now everywhere around the world. And they can start to measure almost every element of physiology and behavior. And where that gets interesting is the fact that, behaviors and physiology can be collected well beyond just the sensor on our wrist, all the way to sensors that might be in your medicine or a digital tattoo. And what we can start to do with this information is sometimes use small data. You might have a patient going home after a COVID infection or after a total hip replacement. Are they walking more, as we'd expect, or walking less? If they're not walking more, maybe we can intervene early. And where this is taking us is a time of quantified self, where many of us have our data on our watches and our smartphones, and moving it to quantified health, where we're trying to collect and share this data with our doctors and our healthcare systems and big pharma to better optimize wellness, to diagnose disease early, and then to manage disease in a much more continuous, data-driven manner. And there's many new exciting ways we can start to collect blood pressure just from your watch or from a patch. Soon we can even collect blood sugar from your camera or wearables without taking any blood. We're at a time of, hearable devices that can measure our heart rate, ringables, technologies that are shrinking and going inside our bodies. So many, many new ways to quantify our health. Even my favorite, underwearables, sensors that can go into your underwear, that can continuously track you without needing to think about anything. You put it in the laundry and it gets cleaned, and you're always collecting your data. And now we're changing payment models so we can start to reward paying and sensing patients outside of the 4 walls of the hospital. There are many other things we can start to measure. Our breathables. There's molecules in your breath that can indicate cancer or pneumonia or COVID. We can use cameras today to pick up our vital signs. Magical AI meets visual can give us an opportunity not to have any device, but to simply use our ambient technologies to measure our vital signs wherever we go, including new ways where we can start to use not just cameras, but Wi-Fi and our ambient environments to start measuring us. Voice could be a biomarker to our mental health, picking up early signs of Parkinson's or other neurologic diseases. Even the sound of your cough might be detected and determine if that's a cold or coronavirus. And even Wi-Fi has been modified now, radar in your home, to pick up the vital signs of many people in the same location. So bottom line, we can start to collect and understand our data in all sorts of locations. The challenge is now we're going to have our digital exhaust, our digitome, collected 24/7. What do we do with that information? How do we make sense of it? Integrating that into maybe a health score, or maybe the idea of your own sort of check engine light for your body. Just like your car has a check engine light, we're going to start integrating information from our bodies to give proactive information to ourselves and our medical teams. We're already seeing evidence that a wearable device can determine days before you have symptoms whether you might have the flu or coronavirus. And together with our social data, we're learning how to put this together, where and who is getting sick, using digital contact tracing. So it's not the future to have our mobile apps tell us who we might want to shake hands with or not shake hands with when we walk into a room. Now, all this data is interesting, but we really need to integrate it into new forms of diagnostics and monitoring. And before we get to diagnostics, I would just argue that each of us can start to use the data about our sleep, on our steps, as simple tools to really get a handle on our health and help us change and optimize that into the future. Now, an important part of health and medicine is picking up disease early. And now we have not just technology in the clinic and the hospital, but anything that can be connected into your home and to your smartphone. The idea of a digital doctor's bag is coming to all of us. You know, you can connect your pulse oximeter or your stethoscope or your thermometer and now connect that with clinical visits that are now done through telemedicine. We're now in the era of smart AI-driven diagnostics, like a stethoscope that has AI machine learning that can enable all of you to be as good as a cardiologist at listening to heart sounds. Or now we're at a time when ultrasound devices are coming to market, also embedded with artificial intelligence, so that almost anybody can do a cardiac ultrasound exam or a whole body exam wherever they might be. So a tremendous opportunity to democratize diagnostics anywhere at lower cost around the world, and to bring knowledge and up-level a nurse or a medical student to be as good as a specialist. Now, these tools are not just for diagnostics of vital signs, but laboratory on a chip. You can now put a diagnostic platform onto your smartphone, not just do blood levels, but hormones and other information. We're even getting rid of the laboratory altogether, the idea of a medical selfie. You might have symptoms of a urinary tract infection. You, instead of bringing your urine to the laboratory, you simply dip the urine dipstick at home, take a picture with your smartphone camera that analyzes the dipstick and sends the information to your doctor or pharmacy, and maybe your medicines are delivered to you by drone. That's starting to happen around the world. And speaking of testing, particularly in the era of coronavirus, we really need home-based, fast, frequent, cheap, and easy testing. This summer, we launched a new XPRIZE for fast, frequent, cheap, and easy testing. Had over 700 teams competing from around the world, including from Chile. We're now to our final 20 winners, and hopefully we'll see new forms of testing come around the world. Once you have been tested, or you've even been vaccinated, how do you prove that? We don't just want medical information stuck on paper. We're starting to see the integration of new digital forms of, like, digital yellow cards to track whether you've been tested or whether you've been vaccinated. That will be very important to opening up the world. We're also seeing new forms of testing come to cancer care, liquid biopsies, where circulating DNA from cancers can be picked up early, when early detection can really help save lives in cancer. And there's been some great work in the government out of Chile with new plans around addressing data and cancer care. Here in the United States, we also have new leadership coming tomorrow, and it's great to see new science and really thought-driven science leadership hopefully impact us in positive ways around the world. Now, with all this new data, we need new ways to make sense of it. Our intelligence requires some assistance with all the new genetics, metabolic data, wearable data. And we're seeing AI play a role now in really being able to, in some cases, augment or replace a radiologist, to even tell what disease you have before the radiologist or the doctor knows, to take a picture of your eyeball and detect and predict certain diseases, or even help your colonoscopy, your doctor doing a GI exam, find lesions they may have missed. So artificial intelligence is playing a role on top of diagnostics to speed things up, not to get in the way of the doctor-patient relationship, but to augment it, and particularly because we have a shortage of doctors and nurses and specialists in many parts of the world. AI is not going to replace your doctor, but in collaboration, do a better job. The doctor or healthcare system using AI will replace those who don't. And there's new ways to implement intelligence and augmentation. Virtual reality is certainly playing a role in changing the way we do medical education, how we can all learn faster, and even virtual reality is now being used as a tool for therapy, for things like physical therapy and managing pain as well. Speaking of therapy, we're now, of course, in an increasingly virtualized world. Many of you have experienced your first virtualized or telemedicine visits. Those have exploded in the time of COVID. They will never go back to where they were before. And that gives us new ways to connect. Sometimes you'll connect first to a chatbot, which can do early triage and help you determine what might be going on before you speak to a doctor or nurse. And also mental health, something that's so important, is also integrating into digital health platforms as well. So we're starting to see a time where we won't just prescribe a drug or a device, but an app to manage depression, to help you manage cancer, to help do clinical trials. And there's so many of these platforms out there today that's hard even for doctors to make sense of this. I've recently launched a new platform called digital.health. That's the website where you can start to learn and start to prescribe the digital tools and solutions that exist and are coming in the future. Last element that's interesting in medicine is 3D printing. We can 3D print braces, prosthetics, masks, hearing aids. I've been working on a platform to even 3D print your own medication. So eventually we'll have a printer in our home and print a medication that's exactly personalized to you and can adapt your medications daily or your supplements if they're needed. So let me close by saying all these technologies are exciting, but what I think is most exciting is that they're getting cheaper and faster and more available and can really start to bring global health and equal health to almost everybody around the planet. It means that we can do clinical trials in faster ways, not just in the academic centers, but in rural villages and towns. It means that all of us can start to be data donors, and we can start to build a Waze or a Google Map equivalent for healthcare where we're all sharing our data, just like when we're driving, to bring that sort of information back to each of us so we can all be contributing to health and medicine. So the future of health and medicine is bright. It's about not any one technology, but the convergence of AI, robotics, 3D printing, sensors, VR, AR, all coming together. It gives us an opportunity to reimagine healthcare. Imagine a global public health corps to help address future pandemics as we collaborate and use these tools. It gives us an opportunity to think that even though we're in magical 2021, which all its challenges, we need to think, where will technology be in 5 years with a $5 genome and new forms of AI and blockchain and all these things coming together? So I encourage all of us, wherever you might be, even if you're not a doctor or in biopharma or in healthcare, to think about taking exponential steps. Because in many ways, the future's already here. It's just not evenly distributed. It's up to all of us to start to not just predict the future, but to build it boldly and creatively going forward. So let's go forth into this amazing future and build this better future for all of us. Gracias por todo. Thank you to Roche for having me here. And I look forward to working with you and our discussions later this hour. Gracias.